Bioidentical injectable HGH therapy is widely used in the United States for the treatment of age-related growth hormone deficiency, diagnosed as adult-onset growth hormone deficiency and hypopituitarism, as a means to mitigate the symptoms of HGH decline. This condition is also known as somatic senescence. Our bodies naturally produce less and less human growth hormone the older that we get, and this is embedded into the way that our bodies age. Science strongly suggests that the physiological changes that take place resulting from age-related human growth hormone deficiency break down our body's ability to repair, regenerate, and rejuvenate itself, exacerbating many issues related to aging. This is why, as we age, we experience muscle decline and diminished cognitive ability. Injectable Sermorelin acetate is increasing in popularity among hormone doctors and medical practitioners as opposed to injectable HGH therapy. One reason is that there hasn't been sufficient study to evaluate the long-term effects of human growth hormone deficiency, and many doctors believe Sermorelin to be a better alternative based upon how it acts similar to growth hormone-releasing hormone. Another reason is that there are strong regulations in place which prevent licensed and board-certified hormone physicians from prescribing HGH injections to their full extent. Sermorelin is less regulated than HGH, and on the balance, physicians are finding that on average there seem to be less side effects with Sermorelin when prescribed in proper dosages. Because human growth hormone injections are a scheduled drug, they cannot be prescribed off-label, and thus are only available to adults suffering from HGH deficiency, hypopituitarism, adult-onset growth hormone deficiency, or HIV/AIDS wasting disease. HGH therapy does not accurately reflect the manner in which the body naturally produces HGH, which reduces the body's ability to produce its own growth hormone. If patients chronically receive too much human growth hormone, it can lead to detrimental side effects. There is a lot of data available with regard to patients with growth hormone deficiency of a pathological cause, but there is much less data available with regard to the use of HGH for age-related growth hormone decline. In other words, HGH is not an anti-aging magic bullet, but it can help to mitigate symptoms associated with low IGF-1. It is clear that, for patients with significant HGH deficiency of a pathological source, that HGH injections can significantly improve long-term health, but the data is insufficient to conclusively make the same claim for patients with age-related HGH deficiency that it is the best source of treatment. Sermorelin, on the other hand, has been showing a lot of promise, according to many doctors and many case studies, as a better alternative to HGH for treating low IGF-1 and mitigating symptoms associated with aging. Many doctors are switching their patients to Sermorelin to treat low IGF-1 levels and finding that there tends to be less problems with long-term use than HGH. However, these are case studies and more clinical research is required to determine what is ultimately fact or fiction. There are also some unanswered questions with regard to the use of HGH injection therapy for such purposes. For example, there is some debate with regard to how human growth hormone treatments may increase cancer risk, or if patients receive too much HGH, it could increase the risk of health issues like diabetes. HGH injections increase IGF-1 and insulin-like growth factor 1 has been associated with cancer and diabetes when levels are too high for too long. There is also the issue with how suppressing growth hormone production by the pituitary may impact the balance of other hormones produced by the body. These issues have all been debated, though no overwhelming evidence has been presented in their favor or against HGH as the best course of action versus Sermorelin. One thing is known for sure, that people who live very long lives tend to have lower IGF-1 levels, so elevating one's IGF-1 levels too high for too long can potentially shorten one's lifespan. They have found in centenarians and supercentenarians that they often have low IGF-1 levels. The bottom line is that the research indicates that people with high levels of IGF-1 over the long term put themselves at higher risk for cancer, diabetes, and other health-related issues. So this is the irony of HGH and Sermorelin treatments. They can mitigate symptoms associated with aging, but at the risk of shortening one's lifespan. Though these risks are backed up by research, Sermorelin and HGH are wildly popular and are continuing to grow in popularity with every decade. It is interesting to note that many people would prefer to look young and healthy and have a higher quality of life at the risk of a potentially shorter lifespan. There are other issues related to HGH injection therapy that have been noted and are inherent in the use of the treatment. For example, since injectable growth hormone is delivered once daily in subcutaneous fashion, there is no way to encourage the body to use the HGH in a natural fashion, as the hormone is immediately metabolized and absorbed. There are no natural forces in place to control the absorption of HGH introduced into the bloodstream. Over time, the use of injectable growth hormone in this fashion can lead to a reduction in the total effectiveness of the treatment. There is also no effective means to exactly diagnose the level of HGH deficiency other than IGF-1 blood test and provide the perfect level of treatment. HGH deficiency diagnosis is the result of analyzing IGF-1 levels in combination with the patient's self-evaluated experience of symptoms in a quality of life questionnaire. This provides the physician with a basis for prescribing a Sermorelin or HGH dosage. Physicians typically prescribe 0.5 IUs to 2 IUs a day of HGH in a 5 days on, 2 days off pattern. Many doctors believe low doses of HGH are the way to go and aim to get their patients' IGF-1 levels in the middle 200 range. More than 2 IUs per day can be dangerous if it causes one's IGF-1 levels to go above 300 to 350 nanograms per deciliter. 1 IU is thought to raise a person's IGF-1 levels by 100 nanograms per deciliter, but this is not exact because one's height, weight, and age are very important factors. Sermorelin dosage is usually 200 micrograms up to about 1,000 micrograms per day, but generally toward the lower end of this range near the 200 microgram dosage. There is a treatment available that can mitigate many of the factors which make HGH injection therapy less than ideal, while also encouraging the body to maintain normal and healthy growth hormone levels. Sermorelin therapy is a growth hormone alternative that has been shown to be just as effective as HGH therapy in the short term, while reducing the risk of side effects and other issues that are related to long-term treatment. Sermorelin is derived from a hormone produced naturally by the human body, known as GHRH, or growth hormone releasing hormone. The medication is also known as 1,29-NH2 acetate, as it is comprised of the first 29 amino acids of naturally occurring GHRH. In other words, it's a shortened version of growth hormone releasing hormone. Thus, instead of 44 polypeptide chains like GHRH, Sermorelin is the first 29 amino acids. This number of amino acids in the chain has been determined to be the minimum length to get a similar result to GHRH. Sermorelin is increasing in popularity among both patients and their doctors because it provides many of the great benefits of HGH therapy for patients with adult-onset HGH deficiency, while avoiding some of the potential pitfalls and cost issues. Anti-aging clinics and longevity specialists have begun to turn to Sermorelin as opposed to bioidentical HGH for this reason. Neither Sermorelin nor HGH are anti-aging drugs, but both can be useful tools in restoring hormone balance for patients. People who are looking to buy real Sermorelin injections for sale can do so by getting a prescription from a legitimate Sermorelin clinic. Take the first step and use the communication form to reach us so we can discuss the cost of Sermorelin with you and what is necessary to get started with a dosage protocol.